The Mediterranean diet and IBD, the relationship between digestive health and nutrition. With the rising incidence of irritable bowel disease, a condition involving the chronic inflammation of the digestive tract, and the unknown cause of it, research pertaining to this inflammatory disorder has become of interest to many. Although we can't exactly say what causes a chronic autoimmune disease like Crohn's or ulcerative colitis to emerge, studies have supported that environmental factors such as diet and stress play a major role. With this information, we can try to combat this growing epidemic using nutrition. Due to the anti-inflammatory properties and overall health benefits of the Mediterranean diet, its effectiveness in the treatment and prevention of irritable bowel diseases is evident. Along with the negative implications a Western diet has had on the risk of developing other chronic diseases such as cardiovascular disease and diabetes, it has no doubt played a role in the prevalence of inflammatory bowel diseases. The industrialization of the food industry has promoted diets with reduced consumption of fruits and possibly vegetables, resulting in a reduced overall intake of fibers, with a high intake of meat, fast food, and trans fatty acids. Trans and saturated fats increase the levels of LDL in the body, which results in inflammation. By abandoning these foods and adopting a Mediterranean diet, a person battling IBD can see reduced inflammation and a healthier gut microbiome. The Mediterranean diet follows a pattern of eating seen in populations bordering the Mediterranean Sea. This diet places an emphasis on consuming fresh fruits and vegetables, nuts, legumes, unsaturated fats such as extra virgin olive oil, fatty fish, whole grains, and a moderate intake of red wine, a low intake of red meat, saturated fats, and sweets. These types of foods have been proven to be successful in reducing inflammation and promoting healthy bodily function. An aspect of the Mediterranean diet that may play a huge role in the treatment of inflammation in an individual with IBD is the inclusion of foods that contain omega-3 fatty acids. Prospective studies have shown that a high intake of dietary long-chain omega-3 polyunsaturated fatty acids was associated with a reduced risk of ulcerative colitis. Omega-3 fatty acids are essential in our diets and have been proven to be anti-inflammatory and effective in decreasing the risk of cardiovascular disease. Apart from eating foods that are anti-inflammatory, there is limited direction on what is recommended for a person with IBD to consume in their diets. These people may have to rely on personal experiences or resources on the internet in order to avoid foods that exacerbate their symptoms. However, this can lead to malnutrition due to restrictive eating and the fact that IBD already makes it difficult to absorb necessary nutrients. 85% of individuals with IBD are reported to have protein-calorie malnutrition, micronutrient deficiency, or both. The Mediterranean diet can also help treat micronutrient deficiency because it recommends a diet plentiful in fresh fruits and vegetables. Fruits and vegetables are an important source of vitamins and minerals, and the majority of those who follow Western diets suffer from vitamin deficiency because these food groups are ignored. Inflammatory bowel diseases can be debilitating and greatly diminish the quality of life of those who have it. It can also be a precursor to many other chronic health conditions. To help individuals with this disease, the Mediterranean diet should be considered as it provides anti-inflammatory and nutritional benefits to those who practice it.